Frenzel goggles. So these goggles are called Frenzels, and they are a tool that we use to assess someone's vestibular system. We use these goggles in a way so that we can actually monitor someone's eye movements. One big way that we use them to monitor eye movements is when we put someone for testing for benign paroxysmal positional vertigo, or BPPV. When someone has BPPV, the suspicion is that there are crystals inside someone's ears that are getting dislodged, and when these crystals start to move around in someone's ears, it creates a false sense of motion and creates this spinning sensation of vertigo. So what we do is we will put someone in the position that exacerbates their vertigo symptoms, and we'll actually monitor their eyes to see if their eyes have this beating pattern called nystagmus. So different head positions should produce a specific form of nystagmus that helps us to determine, is that person's vertigo related to BPPV versus that person's vertigo being related to another condition. One of the other things that we could also do is we also see if there's any weakness of the vestibular nerve. One of the ways that your vestibular system works is that the firing of your vestibular nerves actually helps to keep your eyes stable. Now, your eyes are pretty stable whenever you can fixate on things. So whenever we look at people in light, our eyes can attach onto something and then your brain can actually hold your eyes steady. But if we put these goggles over you and you can't fixate on anything, then it's much harder for your brain to keep your eyes steady because there's nothing to lock onto. And this presents itself when people have a vestibular nerve problem. So one vestibular nerve is weaker than the other. Then we'll actually see that the eyes will start to drift towards the weak ear, and then you'll actually start to kick back, and it'll also create another nystagmus pattern that is characteristic of vestibular weakness. So these goggles are a cheap, low-tech way for us to get a decent assessment of what's going on with someone's vestibular system, whether it's something like BPPV or vestibular neuritis, and it lets us know if we could do rehab on this person and get the person over their dizziness symptoms, or if we might need to refer someone for more advanced vestibular testing if we think we need it. So this way we don't have to just send someone for, a fancy rotational chair test or, caloric testing or things along those lines. If we have a general idea of how well the person's vestibular system is working, and it gives us enough information where we could do effective rehabilitation for that person, then it saves us one step in the diagnostic process and helps us jump straight into doing rehab and therapy and getting the person back to feeling more balanced and less spinning.